Hello everyone, for today I'll be discussing to you a very important clonal proliferation disorder in the name of Polycythemia Vera. So from the name itself, it's poly meaning it's many, cythemia meaning cells. So there are a lot of cells under this pathology. So usually this clonal proliferation is caused by a mutation in a gene known as the Janus 2 kinase gene or the JAK2 gene. A mutation in this gene would now cause the proliferation of these cells in our body, particularly that of the erythroid, megakaryocytic, and the granulocytic series. Thus, we call them as your panmyelosis. In your blood findings, what is very evident in Polycythemia vera is an elevation of your RBC, usually greater than 6 to 12 times 10 raised to 12 per liter, and an elevation in your hemoglobin for male that's greater than 18.5 grams per deciliter, and for female that's greater than 16.5 grams per deciliter. In addition to that, there's also thrombocytosis, usually that's greater than 1000 times 10 raised to 9 per liter, and a marked neutrophilic leukocytosis, which is 10 to 30 times 10 raised to 9 per liter. In addition to that, there's also blood viscosity, which makes your ESR having a low result. And there's also marked hyperuricemia, so that's why some patients may now present with gout. In addition with that, in the bone marrow findings, there is marked hypercellularity, and you could also take note of the panmyelosis. According to WHO, the criteria or the major criterion in the diagnosis of polycythemia vera is for you to determine that there's an elevation of the RBC or greater than 18.5 grams per deciliter in males and greater than 16.5 grams per deciliter for females. And also, you should be able to identify the mutation which is located in the JAK2 gene found in your exon 12. In addition to that, there are also minor criterions such as that of a portrayal of a bone marrow biopsy showing panmyelosis, and there should be, take note, a low serum or urine erythropoietin, and as well as low endogenous colony forming unit activity in vitro.